Someone told you that you need a knee replacement, and now you're sitting at home wondering, do I really? Is there another option? Am I too young, too old? What if the surgery makes things worse? I hear these exact questions from patients every single week in my clinic, and today I'm going to answer all of them, honestly. Because here's the truth. Knee replacement surgery is one of the most life-changing operations in modern medicine when it's done at the right time for the right patient. But it is also one of the most over-recommended and under-explained procedures I know. So by the end of this video, you will know exactly who needs a knee replacement, who doesn't, what the alternatives are, and what questions you must ask your surgeon before agreeing to anything. Knee replacement surgery, or what we call total knee arthroplasty, is a procedure where the damaged surfaces of the knee joint are removed and replaced with artificial components made of metal and plastic. It sounds dramatic, and for many patients, it truly is a last resort. But it's also one of the most successful operations in all of surgery. Over 90% of patients report significantly less pain and much better function after recovery. So the question is never, is knee replacement good or bad? The real question is it right for you, right now? To answer that, we need to look at 4 things. Number 1, what condition leads to needing a replacement? Number 2, the signs that you may genuinely need one. Number 3, the signs that you are not yet ready for surgery. And number 4, what your alternatives are. Let's go through each one. The most common reason for knee replacement is severe osteoarthritis. Osteoarthritis is when the cartilage, the smooth cushioning inside your knee, wears away over time. When it's completely gone, bone grinds on bone. The joint becomes deformed, painful, and stiff. Other conditions that can lead to knee replacement include rheumatoid arthritis, an autoimmune disease that destroys the joint from within, and post-traumatic arthritis, which develops years after a serious knee injury. In all of these cases, the joint is beyond repair. The only way to restore function is to replace the damaged surface entirely. Now, how do you know if you've reached that point? There are 5 clear signs that a patient may be ready for surgery. First, severe, constant pain that is no longer controlled by medication, physiotherapy, or injections. Not occasional pain, constant, daily, life-limiting pain. Second, your pain is significantly disrupting your sleep. You wake up at night because of your knee. That's a serious sign. Third, you've lost basic function. You cannot walk more than a short distance. You struggle to get in and out of a chair. Simple daily activities have become a real challenge. Fourth, X-rays show advanced joint destruction, bone-on-bone contact, significant deformity or collapse of the joint space. Fifth, you have tried and failed at least 6 months of conservative treatment. This is important. Surgery should never be the first option. It should be the last resort after non-surgical treatments have genuinely been given a fair chance. If you have all 5 of these, then a conversation about surgery is absolutely appropriate. Now, here is the part that I feel most strongly about. Many patients come to me after being told they need surgery, and when I examine them, they are simply not at that stage yet. So, let me tell you the signs that you are not yet ready for a knee replacement. 1. Your pain is manageable. It hurts, yes, but you are still able to sleep, walk, and carry out your daily life with some medication or support. 2. You haven't tried proper physiotherapy. Not just a few sessions, a consistent, structured program over several months. This alone can change the outcome dramatically for many patients. 3. You are significantly overweight. Every kilogram of body weight adds roughly 3 to 4 kilograms of force on your knee. Losing even 10 kilograms can reduce knee pain substantially and also make surgery much safer if you do need it later. 4. You are very young, under 55 or 60 years old. Knee implants typically last 15 to 20 years. If you have surgery at 45, there is a real chance you will need a second knee replacement in your lifetime, which is a much harder operation. 5th, your X-rays show moderate arthritis, not severe.
Moderate arthritis can often be managed for many more years with the right treatment. If any of these apply to you, please get a second opinion before agreeing to surgery. You may have more time and more options than you think. So, if you're not ready for surgery, what can you do? Let me give you 5 alternatives that genuinely work for the right patients. Number 1, physiotherapy and targeted exercise. Strengthening the muscles around the knee, especially the quadriceps and glutes, reduces the load on the joint. I've seen patients avoid surgery for years through consistent exercise alone. Number 2, weight loss. I know, nobody wants to hear it, but the evidence is undeniable. Even modest weight loss has a significant, measurable effect on knee pain. Number 3, intra-articular injections. There are 2 main types: corticosteroid injections for inflammation and pain relief, and hyaluronic acid injections to lubricate the joint. These don't fix the arthritis, but they can provide months of relief and buy you significant time. Number 4, bracing and orthotics. A well-fitted knee brace or orthotic insole can offload pressure from the most damaged part of the joint. Simple, non-invasive, and surprisingly effective. Number 5, partial knee replacement. If only one compartment of your knee is damaged, not the whole joint, a smaller, less invasive operation called a partial knee replacement may be an option. Recovery is faster, and the results can be excellent. Let me leave you with this. A knee replacement is not a failure. For the right patient at the right time, it is genuinely one of the most life-transforming things that modern medicine can offer. But it is a major surgery. It requires recovery, it carries risks, and it should never be rushed into. If someone is recommending surgery to you, ask these 3 questions. 1. Have we truly exhausted all non-surgical options? 2. Am I at the right stage of arthritis for this surgery to be worth it? 3. What happens if I wait another 6 to 12 months? A good surgeon will welcome these questions. They will take time to answer them. If they don't, seek a second opinion. You are your best advocate. If you found this video useful, please share it with someone who is facing this decision right now. It could genuinely help them make a better, more informed choice. Leave me a comment below. Are you considering knee replacement, or do you know someone who is? I'd love to hear your story. Don't forget to subscribe for more honest, practical orthopedic advice every week.